So we're here with the Dr. Stephanie Morgan, world-class Ironman athlete. You're competing, later this year?
Yeah, so I'll have the half Ironman World Championships in Spain in November, but I've got one that I'm ramping up for in May in Chattanooga. So it's just kind of like a breaker of the ice kind of thing, just getting me back into the routine of things. So just ramping up my training right now.
I love it. That's
Yeah.
that's months away.
Yeah.
But you're starting training now.
You have
which is-
to.
Yeah,
Yeah.
It's insane.
Yeah.
To compete at that high level.
Yeah.
But almost as a juxtaposition, one of your roles here as a physical therapist is particularly on our pelvic floor side.
Mm-hmm.
So talk to me about that, endurance training at the highest level, and then pelvic floor therapy.
Yeah.
That's Stephanie. There's a lot of space in between. Can you fill those gaps for me?
Yeah. So as a physical therapist, I've been a PT for 11 years and I graduated from MUSC, and I thought all I was going to do was sports medicine because that's all I experienced. And so I went into sports med and it was great, and orthopedics. And so I have a good baseline understanding of just the musculoskeletal side of things. But once I got pregnant and had my first child, I was starting to have some lingering issues musculoskeletally, like through my hip. And so I saw a pelvic floor therapist. I was living in Spartanburg at the time and seeing a therapist in Greenville, and I saw a lot of benefit from it, and I felt like more people should know about it. So
Sure.
I really pivoted my specialization and career to seeking more of pelvic floor therapy, and that was really just never something that I thought I would do. And
really?
at MUSC, we got a few lectures on it, and I really didn't take it seriously until it affected me personally. So I pursued a little bit more training in that, and I've been doing pelvic floor for almost 7 years now.
Great.
And it's been a little bit of dabbing in and out of orthopedics and pelvic floor, but I think in order to be a good pelvic floor therapist, you have to be a good orthopedic therapist.
Oh, for sure.
You can't miss looking at the spine or looking at the hip or just the basic external exam and how that plays such a role in the pelvic health side of things. So never thought I would be doing something like this, but it's very interesting because people don't think of that as my personality.
Sure.
Because I'm kind of a hard ass in itself.
Let's break that down a little bit.
Yeah.
So very different worlds,
Yes.
right?
Mhm.
But very, there are some big similarities.
Mm-hmm.
And you've talked a lot about your heart for the female athlete, specifically the female endurance athlete, and how it kind of messes with the pelvic floor system overall. And that's been a soapbox more or less for you. I feel like that's where it connected, and that's what I know about you. Can you talk about that a little bit more?
Yeah. I also, in saying that, I really don't think we have this social expectation of being able to rebound pretty quickly.
Right.
And you yourself kind of are experiencing that yourself.
Yep.
In terms of we as PTs think that we should rebound quickly, but we don't give ourselves enough grace in tissue return. And it comes from ACL repairs to major surgeries that require a lot of anesthesia to C-sections, to hysterectomies, to pregnancy that lasts 9 months, to traumatic births, to postpartum life. And we expect our bodies to rebound. And that's really not what our body is made to do, because in terms of a pelvic health perspective, we're nursing, we're taking on a lot of mental load, trying to do all the things, and we kind of put ourselves to the side. And that's okay. I want people to understand that, I personally didn't get back into true training again until 5 years after my second child, because I couldn't truly dedicate that time and allocate time to training like I wanted to again. And that's okay. I think being able to pivot and do stroller strong stuff or doing other forms of movement and exercise are okay. I think runners kind of come into this sense of, I got to get back to running.
Right.
And that's not always the best thing for your body at that point. And doing Pilates-based work or bar-based work is probably the best thing you could probably do. Is just doing small isolated movements when it comes to diastasis or urinary leakage or whatever that may be. But all of that stuff builds up to the end result of maybe a year to 5 years postpartum of being able to get back to running without leakage, pressure, pain.
Sure.
So you have to have that good foundation in order to be able to get back to that high level. And there are a lot of people that I run with personally that we get faster after we deliver.
Really?
And I think it's not, I think there's probably research out there about hormonal components to that, but I think our mind frame is very different and we prioritize differently
Mm-hmm.
than than our folks who are runners who haven't had a child
Sure.
yet. We prioritize, okay, we're going to have to get up at 5 o'clock in the morning and be in the pool, or I do have to run late at night. And that's just going to be how it is because I have to be around for my kid. So I think it's really interesting getting back into high performance and allocating time management, but also like knowing what's most bang for your buck
Mm.
when it comes to the forms of exercise that you're doing at that certain timeline as you're recovering.
So I hear this like timeline specifically, like, and I kind of blew my mind that you have 5 years after your second kid
Hmm.
is when you started getting back into things at a higher level.
Hmm.
What did the in between look like? Because I feel like if we talk about our athletes or different just people that we treat to help them reclaim different parts of their identity, when they can't do the thing that they've been wanting to do, if that's cooking a meal or if that's running a triathlon
Or dunking a basketball.
or some, yes, like you go, like you have this identity crisis, right?
Hmm. Yeah.
And it took you 5 years to get like more or less regain the identity, because
Hmm.
from my understanding you were a college athlete
Hmm.
for endurance and track and all these kind of things. um Athletes have this switch, right? Athletes have this like weird thing where it's like when if they can't compete, if they can't do the thing that they've dedicated honestly most of their life towards,
Hmm.
like this identity just goes away. So in that 5 year time, like you weren't running, you weren't doing at least at a higher, like the high level that you expect running to be, which for anyone who might be listening to this is Stephanie, like her easy runs are definitely harder than a lot of people's normal runs. So
Yeah.
like the perspective of having an athlete mindset, that 5 year gap between birth and feeling like an athlete again, what did that look like?
My identity became caregiver.
Mm,
So I had to kind of
interesting.
put to the side, quote, athlete, what was my idea of athlete, which was very high level, but I became caregiver.
Mm,
And that's okay. And I think us athletes struggle with that idea of becoming caregiver. And it wasn't just for my kids, but I was taking care of my dad as he was going through illness, and kind
mm,
of as he passed away, I became a caregiver.
mm,
And it was okay. And I was running during that time. It just wasn't able to be as high of a
right.
priority. I think we struggle with psychological and kind of sports psychology of being able to reshift our priorities and just know that they're not permanent and they're kind of dynamic in what they are. And we can always come back to it.
Mm-hmm.
But being able to dip into other forms of movement, like you said, like, oh, I'm going to run a 5K, or, I'm going to do a lot more weightlifting. And that's okay. That the identity is going to continuously pivot. And I think we have to have grace in that process
Mm,
to know that, I don't know, our identity is going to constantly change. Um, but being accepting of that is really super challenging in the
yeah, oh, for
moment.
sure.
And making short and long term goals is good, but know that there's a lot of work that goes into all of
Oh
that
yeah.
too. And it's a lot of things that you don't see from the outside. And
Mm-hmm.
people will come to me and say, I don't know how you do it all. And I say, I don't either, but I figure out a way to do it because I have to, or I want to. And so I think there's a lot that goes into just reprioritizing, re-identifying a little bit, but also like knowing that there's a lot to your identity that doesn't have to be permanent either.
Oh
And
man.
and you can kind of recircle around to that too.
Okay, so that's for the athlete, right? It's
Yeah.
the athlete side of things. What
Hmm.
about say it's like just your average new mom,
Hmm.
right? I mean, it's not my world, but giving birth just seems like a lot. Just like, I mean, and obviously it is, like,
Yeah.
no doubt. But I mean, there's there's very key similarities of recovering from a childbirth as like ACL rehab, which is what I love. Um, that person now becomes a mom, and her identity changes from I've never been a mom before to now officially I am a mother. You went through that for the first time, and then obviously you have more kids, so
Yeah,
like
too
so,
soon.
yeah,
Too soon.
I hear it. But yeah, like that identity shift, right? You said you shifted to caregiver for both your dad and your kids. What advice would you give to the new mom? Like, I mean, like it's the same journey, right? Like that, there's so much of your life that just gets upended.
Yeah.
How do you communicate those things and the different struggles to a new mom, and what advice would you give to them?
A few of the common phrases that I say is give yourself grace in whatever time frame that looks like. I like to overshoot healing because I want people to know that it can be a year. I also tell people to be patient with the process
Hmm.
because we may not have control over tissue healing like
Yeah.
that because there's so much going on from a hormonal perspective.
Hmm.
And then we have to give that the grace it needs in terms of
Hmm.
breastfeeding and going back to work and still being able to like somewhat formally exercise. But that's the biggest shift I think that we see our pregnant and postpartum moms. They have this idea of what exercise was, and they want to get to back to that idea of what exercise was.
Mm.
And they kind of try to force it a little bit, whereas it actually just, you just need to integrate exercise into your functional
Right.
activities. You've got an 8-pound baby that grows to be 20 pounds by 9 months. So it's progressive resistance training,
Right.
right? You're going to be squatting.
I never heard that before.
Yeah, if you truly think about strength guidelines in terms of percentage effort, it's progressive resistance training.
Wow.
So people think that weight training has to look a certain way, but like you're carrying a 15-pound baby on your left hip because you want to keep your right arm open to be able to stir the pot of pasta, right? Like you're lifting constantly throughout your day. You're deadlifting into a crib or a bassinet. You are squatting down to the floor to pick up a sock, right? You are integrating movement and mobility into those kind of concepts, but how we engage the core, how we engage the pelvic floor into that is going to be a little bit of the new normal. And it just may not look as it used to.
Mm.
Um, so I think a part of the advice, like you said, is one, giving yourself grace,
Mm.
patience with the process, and integrate exercise into function.
Interesting.
And knowing that it's progressive resistance training until you can't lift them anymore. I don't know. I have a 9-year-old
Yeah.
who's like probably 60 pounds, and I tried to lift him the other day. Or
I love it.
piggyback rides. Like
Yeah.
you're going to constantly be moving or wanting to like run with your kids in the playground. And it's just different forms of movement. And again, it's a little bit of an identity shift, and that's okay.
Yeah.
But just know that keeping moving is just going to look different. That's okay.
And the difference is so interesting because like it's the same kind of constraints, right? There's the logistical barrier they talked about, like just transparently, like when you have like a lot on your plate, you typically will still get the big priorities in, right? I heard it described as big rocks first. You know,
Mhm.
it's like you have like a basin, then you have like if you're gonna fit like the big rocks, the medium rocks, the little rocks. If you fit the little rocks in, then the medium rocks, the big rocks won't fit.
Mhm.
So it's like if training becomes a big thing, or motherhood,
Mhm.
or whatever have you that's important to your life in that moment, if you're able to identify which one of those are big rocks and like which one of those are medium sized or little rocks that are disguising themselves as big rocks, you can find a way to make it happen. And that is all taken with a grain of salt because you talked a lot about grace, giving yourself grace. And I think that no matter if you've given birth or not, able to or not, you need to be able to do that, especially when these big traumatic things happen. I think that's super, super key. So that's awesome.
Yeah, and I think that's not permanent either.
Yeah.
The big rocks can shift to little rocks, and the
Yes.
little rocks can shift to big
Oh
rocks.
man.
So I think just knowing that it can reprioritize, and that's
Mhm.
okay. And I think in the moment, a lot of times we say, gosh, I've really put myself on the back burner,
Sure.
but that's not permanent. And that could be tomorrow it changes,
Hmm.
or it could be, hey, 6 months or a year from now that changes. And that seems like so far away, but and people say to enjoy like the younger years of your children, but it really does go by quickly.
Mhm.
And then we grow as adults, as humans, as parents. And so we time management, I think, is just how we fit everything in
Sure.
and how we are able to reprioritize
Sure.
kind of all the things. So I don't know. Looking at Sam and Katie going into parenthood, we could tell them all the things,
Oh, sure.
but I think experiencing it for themselves is
Mhm.
going to be where they learn the most
Mhm.
about each other as parents, but also like as couples or whatever it may
Mhm.
be. And so being able to complement each other is probably the safest thing moving forward.
Oh, for sure.
Yeah.
It definitely takes a team effort.
Yeah.
I've been around parents,
Yeah.
new parents. I'm not there yet.
Yeah, that's okay.
But it's something that I truly do look forward to.
Yeah.
So that's, I mean, super exciting.
Yeah.
Something I did want to ask
Yes.
was on my like little list of things I wanted to ask Stephanie Morgan. What are things you would stay away from as a new mom? Like we talk a lot about what you can do and
Mhm.
all these things, but like there's a lot of like there's so much literature, so much lore, so much opinion about how to handle childbirth and like how to go after it. Like I hear the same things that I hear like old school athletes talk about. You're 2 weeks, you're fine. Rub some dirt in it, like some whatever, like just get over it. Moms do it, like whatever.
Yeah.
Right? Like what is the line of understanding, no, that's not good for you.
Yeah.
And like, yeah, I can power through this. Like what are some things that you would stay away from or like kind of like be weary of?
So I think the biggest thing is really just listening to your body and knowing if something is painful, something is versus sore. Soreness is different than pain. And having that being able to self-reflect on that's really important. Having any pressure itself vaginally
Mm-hmm.
or even just having leakage itself, like that's not something you want to push through or
No.
saying, hey, okay, I'm going to go back to burn boot camp but I jump and I constantly leak. And I'm like, well, that's not something you push through. Let's make some modifications. And that's okay. And let me show you how to modify jumping
Yeah.
and how to jump properly by using some overflow muscle groups. So, like, you don't want to push through something that is, I don't know, encouraging the symptom itself.
Sure.
Just like orthopedics, like, you're not going to push into pain. You might push into soreness.
Mm-hmm.
And having people self reflect and that understanding of what that means is
Mm-hmm.
really interesting. Um, the other thing I tell people to really be leery of is some of this advice that says you have to do it this way.
Mm.
Right. And
Mm.
so, like, especially when it comes to like diastasis, a lot of people are very fearful of diastasis. And during pregnancy, it's a little normal, right? Like, you have to make room for baby somewhere, right? So, we have to expand the pelvis.
Mm-hmm.
Um, Postpartum is kind of where we start to really look at that. But then there's some people who say, you can't do planks. And I'm like, well, you might be able to. Let's take a look at it.
Mm-hmm.
Or, I don't love when I hear pelvic health therapists say you can't do Kegels. Well, like, let's do them properly and
Mm-hmm.
integrate them into function. So I struggle with any community who thinks that their way is the right way, and it might not be the right way for everybody.
Sure.
And so I think from a postpartum perspective, obviously we can't see what's going on.
Oh.
We can like understand symptoms, but I think the biggest thing is having an assessment to really understand what's going on.
Mm-hmm.
And then we can move forward from there in terms of giving you the most individual plan of care from that so that we can know what to build upon.
Yeah.
Because if I say I go in there, but if I go in there and and I feel a tight pelvic floor, like I'm not going to give that person Kegels, but I would never know unless I didn't go in there.
Yeah.
So like, but then if there's weakness or like bogginess of the tissue, then yeah, we do need to work on Kegels or a proper pelvic floor contraction. And what does that look like? What does that feel like? Let's give you internal vaginal cues.
Mm-hmm.
So I think there's a lot that goes into being able to be individualized in care, which is what we kind of specialize in
Mm-hmm.
here. And so we want to make sure that people are getting the right exercises for the right symptoms.
So like the one size fits all thing is just so difficult because
Yeah.
like I mean it's so hard. There are general things that work for everyone, but every person is different. I heard a mentor once tell me that n equals 1. N is just the population of a study. you can have the perfect person that matches every single study for this thing, presents exactly how it would be like in a textbook. This is how you would treat, and then they react completely different, right? N equals one, and especially with childbirth, sounds like that's extra important. It must be super fulfilling to actually like identify those things for you to in your patients.
Yeah, yeah.
What are the more rewarding parts of what you do? Like why we talk a lot about the problems we solve and all things. But why is it important to you to keep doing those things?
So I think the specialization in what we do is becoming more of a hot topic.
Mm,
So I really enjoy being a part of the hot topic
okay.
and people advocating for themselves. And I think the providers are really seeing a little bit more benefit of what we do.
Sure.
So it's not that we're just changing the community and the patient population, but we're changing the healthcare system and how that looks.
Mm,
So I think we're really on the front end of a revolution when it comes to women's and men's health. So I don't want to like put that to the side
yeah.
either,
Mm-hmm.
but knowing that there can be some good conservative care and collaboration within our providers as well. So I think being a part of the change is pretty cool.
Yeah.
And seeing how my career has changed over the
Mm-hmm.
years to not just be a one size fits all, that I can look at the whole system as it works together.
That's incredible.
Yeah.
So the rewarding part's like, oh man, like this is something you've experienced yourself. From what I hear, right? It's something you've experienced yourself personally. You're like, oh, I'm in the position right now to help other people do that. You've done that. And now you're with us and be able to do this even more. And keeping on increasing that platform for yourself, and not to build yourself up, but because you've gone through this process, from performance to recovery, from thriving to surviving. Like there's just so many different aspects that I hear in your story, which is amazing. But also you want to share these things, right? And it's important for you to actually be able to make a difference in some people's lives, and the better, again, we can change healthcare in a lot of ways. Like you said, like you're at the forefront. Y'all are pioneers in this space, when it comes to how it can look like, and that is really cool to hear.
Yeah.
If you can make one big change to the healthcare system right now when it comes to pelvic floor specifically, what would it be?
I think everyone deserves the ability and opportunity to be assessed.
Mm.
And again, it's so hard because it's not like you fell on your arm and broke your arm, and I can be like, oh yeah, like you have a bone sticking through your arm. It's a more intimate conversation.
Mm-hmm.
So being able to set aside time to even just have the conversations
Mm-hmm.
or have the assessment itself, a lot of people can take that moving forward.
Mm-hmm.
But I think everyone deserves the opportunity to have one visit.
Sure. What do you think is the hang up between someone who's like on the fence of like, oh man, I don't want to, like my mom never had pelvic floor therapy.
Mm-hmm.
Like this didn't exist before. Like why would I be like special, or like what's the deal? Like what was the thing that is stopping someone from coming?
A couple things.
Yeah.
So insurance,
Yeah. Yeah,
finances,
for sure.
time management.
The more.
Yeah, honestly, like
Really?
we reprioritize.
Interesting.
So like I think the biggest thing is that people don't prioritize it.
Mm.
And that's okay. I
Yeah.
didn't,
Yeah.
right? I didn't see somebody until like at least 8 or 9 months postpartum.
Is it too late when that happens? Is there ever a time where it's too late?
Never. So tell people you're 6 weeks, 6 months, 6 years postpartum, you've always had a child, no matter if it's a C-section or a vaginal delivery.
Mm.
So it's never too late to be able to kind of reassess things. And
Mm-hmm.
again, you've reprioritized your goals at 6
Yeah.
weeks, 6 months, 6 years. So what do we need you to, or what do you want to get back to doing, and how do we do that properly? So being able to just have the one assessment or plan of care, whatever that looks like, but are you ready to commit to that or integrate it into function?
Mm.
So I think everyone deserves the opportunity to be able to be seen,
Mm.
and assessed to know what to do moving forward.
How could you, if you could be in the ear of every mom who has ever given birth ever, right? Yeah, like 10 seconds to whisper something. And it's particularly to the moms that haven't had the experience of a pelvic floor therapist or anything like that. What would you tell them?
I think I would tell them. I think a lot of people are fearful of what we do.
Mm.
And I think it's just about teaching them like what we do and why we're looking at that, or they're afraid of the internal exam. But I think it's just teaching them this is why we're looking at this and what we're looking at it for.
Mhm.
So I guess the biggest thing would just be is you may not have a symptom, but a lot of people just come to us just to know that everything's right down there,
Yes.
you know, and that's okay. I want to know that everything's right down there too,
And
and even for men as well. But
yeah.
I think that would be kind of the other piece of that is just like let's just make sure everything's
Mhm.
going right down there.
So there's a lot of benefit just to even being seen. No
Yeah.
matter if you have any kind of trauma, right? Like you don't think twice about going to the emergency room if you broke your arm, like you talked about, or if you had a surgery. You don't have many qualms about PT because, like, oh yeah, I just had operation. I know that there's a deficit there, but there's this like disconnect, right? It's like, oh yeah, like I had this huge trauma to my nether regions of all these things happening all at once, plus my hormones are all over it, plus my mental health side of things, plus, oh my goodness, I have a baby I have to take care of, and all these other things.
Mhm.
Like you said, like it's just the priority of the function just kind of goes away. And I love the way they phrase that. It's like it's okay. It's like nothing to be fearful of. And even if it's just to know that everything's going right down there, that's huge. So,
Yeah.
I think, yeah, I really enjoyed what we talked about today.
Yeah, me
It's
too.
incredible.
Thanks.
Yeah, you can find Stephanie online. I don't know how to end these things.
Pelvic Queen.
Pelvic Queen on social media, and yeah, if you're on the fence, definitely check her out because it'll be worth it on every side of the spectrum.
Yeah. You don't have to run a marathon though. I tell people you don't have to be a triathlete to see me. It's okay. Like I'm not going to make you run all the time.
Very good. I love it.
Yeah. Thanks, Kaipo.
Yeah.
This was fun.
Yeah.